Anyway, thank you for the invitation here at EHRCON25. I really feel honored because it's like since 2 years I'm industry partner, a startup industry partner. I saw this morning partly my logo, on the screen. So I'm very happy to be here, and I'm here also like to present the digitalization of the WHO yellow vaccine booklet. You probably have one at home, a paper version. Can I see some hands who has one at home? Because like people would travel to Africa or to Latin America probably have a paper version at home, or lost maybe multiple ones, because I also hear many people have even the foldouts with all the extra pages knitted together. This iconic book has been around for more than, I think, since 1946 or something. So already really a long time this book has been around, and now it's going to be digitalized. So that is really something. And I want to discuss with you also if openEHR is a really good base for this. I think so, but I just want to check with this audience here. So if you want that, like to share your technical input, your ideas, please feel free. But let's go back to the year of 1997, where I was traveling myself for the first time in Africa and using the ICVP, the yellow vaccine booklet. And now I would like to have a flipper. Yes, okay. Is there one I can use there, from there? So I just show you this is where I come from. This is my background. I've been tropical medicine doctor, did a PhD later in malaria vaccines research, and you see here me working without any digital electronic health records, without any electricity even, back in 1997 when I was using my own ICVP for the first time, my own digital vaccine booklet. This was in Ghana, West Africa, where I was working in the hospital there in the capital, in Kolebu Hospital in Accra, and later I also volunteered on the hospital ship on Lake Volta. I was 22 years old here, and I was using my own digital vaccine booklet. Next slide. So you see, next slide, please. So this is probably the end of an era, because we were collecting all these stamps all these year long, all these years, and this is going to end. So also the foldouts and all the other travel memories we have from this digital booklet. So next slide, please. So a very short history. You can click a few times more. A very short history to give you an impression how old this book is and how iconic actually this booklet is. Already in 1951, many countries in the world were exchanging knowledge on the most important infectious diseases, because previously only in one country the people were trying to combat these infectious diseases. But more and more, when time passed by, there were many organizations made, and among them is of course the WHO, to prevent the outbreak of infectious diseases. And already in 1933 in the Netherlands, in The Hague, were the first vaccine certificates issued. This was globally the first location in the world where it actually happened. Next slide, please. And in the end, next slide. In the end, it goes a little bit too fast. Okay, in the end, of course, the WHO was initiated, and then also the yellow vaccine booklet was introduced. And still, as today, this is the global standard for the verification of essential vaccines like yellow fever, like polio, and many others. Next slide, please. Yeah, so, and of course this has also to do with pandemic preparedness. We already had Loes this afternoon about this from the GGD, GOR, and already WHO at that time had made preparations for pandemic preparedness. And since 1951, the yellow card, the ICVP, is the global standard for proof of vaccination. Next slide, yeah. And the World Health Assembly now is focusing mainly on, at that time in 1969, on cholera, plague, smallpox, and yellow fever. Next slide. And later that changed because some vaccinations were not useful anymore to log, and now it's only yellow fever only at this stage. Next slide, please. So the digitalization, how does it go? Because now we are talking more in digitalization. The WHO has the task to streamline, to coordinate, and to standardize and make the data interoperable worldwide. Of course, we all know it's a big jungle of health data formats everywhere, and that's why openEHR needs to be, of course, implemented everywhere. Next slide, please. Next slide. Yeah, you can go on. So it's all about the digital vaccine certificate. It's a proof that the vaccine, that the holder is vaccinated against a vaccination, and we will use globally the digital COVID certificate as the base of the digitalization of the ICVP. And we use the original electronic health container format, the EHRCON25, now to digitalize the yellow vaccine booklet. Next slide, please. So there will be or are currently national and regional digital vaccine certificate initiatives, and they all need to be made interoperable. That's why, of course, the WH will be using the data schemes or open standards, of course, the HL7 FHIR, SNOMED, ICD-11. openEHR is not included in that list yet on WHO level, but they're making it prepared to be interoperable. And of course, it's, as we all know, a heterogeneous landscape with local regional vaccine certificate initiatives, and this requires strong global tools. And I think openEHR is a perfect candidate for this digitalization. And the current EHR mandate is to focus on yellow fever and on polio, and also on other future emergency vaccines that will be available. Next slide, please. So how is the verification and the exchange being operated? That's done by the WHO Global Digital Health Certification Network. This is a global network for the exchange and the verification of digital health vaccination certificates, and it's all based on trust. So all the countries who are member of this digital highway can use the verification by WHO. It's all based on trust, of course. Next slide. So in the end, there are three uses to make it very, very simple. First is, of course, the digital health vaccine holder, you and me who are traveling anywhere. This can be done through in a digital wallet, or also by the means of a QR code, a sticker in the current paper version that will be like a dual option for the coming maybe 5 or 10 years probably, because not everybody probably has a digital variant yet. It's not functioning maybe yet everywhere. So there will be a hybrid solution in the meantime. And then there's the certificate issuer. That is the local government in your country who is going to issue the digital health certificates. And the verifier, that's the person at the border or somewhere else who is going to verify if you are properly vaccinated against yellow fever. Because yellow fever is the only one which is officially required to have an official stamp. Only certain doctors who are approved, can stamp the yellow vaccine in the booklet and also digitally. So that is something else than all the other vaccines. The yellow vaccine booklet is also more like a passport because it allows you to go into countries, yes or no. Eh? So this is different than just a collection of vaccines. It has more like a more formal connotation. And the verifier I already talked about. Next slide. So how does this go? I'll take my pointer. 1 second. I can point. No, it's gone. First, all the countries receive the public keys. So, for example, in the Netherlands, the LCR, our national vaccine, travel vaccine coordination center, will issue the public keys after the person has been vaccinated, and these public keys will be sent to all the members globally. So all these countries globally will receive this public key that you have been. Laser, yeah, thank you. Nou, op een scherm werkt het niet, denk ik. On the screen, it's anyway. So 1 second back, please. One slide back. Yeah. So like when a person is vaccinated, for example in the Netherlands, then then there will be a public key sent out to all the countries worldwide. If this traveler with this digital vaccine card will arrive in the country, then these two will be matched. Like next slide. These two will be matched. Like the participant code, either being a QR code in your paper version or a digital variant in your wallet, will be matched with the public key, and that in this way the verification can be authorized. Is this clear to everybody? Yeah. Okay. Next slide, please. Yeah. Here is the verification signature using the public key. Next slide, please. So the paper version health certificate is the template for the logical mapping of the ICVP. Actually, exactly the same. You know the paper version. Your name is there, the vaccine, the badge. All these things will be copied identically in the digital variant, as you can see here, and also the vaccine details, the product ID, date, issue, badge, validity. Next slide. Next, yeah. So you see here a summary of how this going to look like. All of this will be probably by WHO next year summer ready for launch. So yeah, we have some like 3/4 of a year to work on it more and to be like in line with WHO. If locally more fields need to be available or needed, the WHO will take care of that. There will be also a way of like selective disclosure on name, sex, date of birth, of name of clinician, that some elements can be excluded or like digitally not available. They're not sure exactly how this is going to look like, but that should be included in the digitalization. Next slide. And there will be also business rule execution. For example, if certain vaccines are only valid, for example, for 5 years or for 10 years. So it's not that if you show up with some vaccination and it's only valid for 2 years that it will be impermanent valid. So there will be also business rules execution built in the digitalization. Next slide, please. Yeah. What's very important for WHO is a digital equity. And there will be also a digitalized version for people who have no IT devices, no telephone. This will be done by means of a QR code, a sticker in your yellow vaccine booklet, in your paper version. Of course, in the future, I think, yeah, this probably will be abandoned, but I think for the coming 5 to 10 years, it will definitely be hybrid. And also, is there a local power outage, for example, at the airport in Africa? Can happen, of course, sometimes. Then in these cases, the verifier can call the issuer. Of course, this is quite laborious if there's an outage, but at least it will be a possibility that like somebody at the vaccination standard of somebody can be verified. Openness is very important. At this Congress, of course, the use of open standard is required, obligated, and also there will be like a white labeled libraries will be available, but there will be no WHO branded verifier app available, but every country can use the minimal version, like the base version, which will be distributed from WHO. Next slide, please. Yeah, and there's of course a linkage to the upcoming European Digital Vaccination Card, UVAC. This is a European vaccination card where you can collect all your vaccinations. There will be like one-on-one interaction between the two. Next slide. The IPS, the International Patient Summary, there will be like one-on-one exchange. The vaccine section, the immunization section of the IPS will be like fully exchangeable with the ICVP. So the ICVP should be able to fill the section of the immunizations and vice versa. And this is HL7 synthesized. Next slide. You can click a little bit further. Yeah. Next slide, please. So where to keep the digital ICVP? You can use the WHO branded digital wallet that holds the vaccine certificates, but you can also use any other wallet, for example, your Gullet or Apple Wallet or EU Wallet in 2026. And the Open Wallet Foundation is there to look for their interoperability, that you can, for example, move to another country within the EU, or that you, for example, if you are a parent and your child has the vaccinations, that you can hold these vaccinations, these digital vaccine certificates, and if the child becomes older, that he or she can have her own wallet. And the identification of the person in the ICVP is relatively weak, and I found out myself because I looked back on my own ICVP and I saw that like retrospectively, that I filled in my own name, so my own signature. So I had to actually the stamps were there, but I had to fill in my own name at that time in 1997. So that's very weak, and this will be the same as now in the digital variant. But now the connection with the digital identity certificate will be there. Your digital passport. So this will be the link. So and this means now it's secure. The same actually as more or less as your passport, which you always have your yellow vaccine booklet together usually when you travel, so you can identify that it's you. Next slide. So the digitalization in the Netherlands, het gele boekje, the yellow booklet. This is how it looks in the Netherlands. I work together with NICTIS, LCR, and our Ministry of Health. So we will be, like NICTIS is a knowledge center for digitalization in healthcare in the Netherlands. They produce information standards for interoperability and data availability. And they're now working on the second version of the vaccination standard, to disclosure of the vaccination data to your personal health environment, and later for the travel vaccinations. Next slide. So where are all these data in the Netherlands? Unfortunately, in the Netherlands, we don't have a system, like a national system, where all the vaccines are at one source. Unfortunately, that makes it even way more complicated, because these data is at a lot of places. At GPs, hospitals, at commercial vaccination centers. They are at municipal health, GGD Amsterdam, there are a lot of vaccination data. So we all need to get these data and make them available. Next slide, please. Yeah. So this is the next step. So first we need to finish the vaccination standard, then we need to digitalize the yellow vaccine booklet, and then we need to make it ready to be aligned with WHO highway. Next slide. Yeah, so I have a few questions, like the use of openEHR as the base for the ICVP. Are there any pro or cons that you think? I think I see only positive future interaction, but if you guys have, you think like, wow, now this is absolutely not a good idea to use openEHR as a base for the ICVP. Does anybody have any input maybe after seeing the presentation? No. Second question is, openEHR in combination with eHealth.eu and the IPS. I don't know exactly how so far, how the interaction is there yet with the eHealth.eu. Maybe does somebody know this? Are there already? Oh yeah. Okay. As part of the EHDS, you mean, or? IPS, yeah. Next slide, next item. And I'm also preparing electronic health record for travelers, seafarers, and offshore professionals, because I've been traveling myself a lot, and I also been working a lot with seafarers, and these people have no own electronic health record. They move, for example, the seafarers, they go hop from port to port, and they still collect their electronic health records on paper with them. And I want to build like a electronic health record in conjunction with the digitalization of the ICVP, because also, for example, the offshore professionals who are working in Africa offshore, they need a lot of vaccinations, and there, currently there's not like a standardized electronic health record for them to carry all the time with them. And we can use this, of course, for pandemic preparedness, to build in like software where you can, where people can detect if they are sick or when they have health issues. We can use these data maybe for like together with the GGD in the Netherlands for pandemic preparedness. If any suggestions or questions? So far, yeah, here. Yeah. And I had the yellow book in Ireland, and when I moved to Canada, I brought it with me. But I had it with me. Now, if Ireland is issuing it, would I get it in Canadian digital version, or do I need to? If all these countries are connected to the WHO highway, the GDHCN, then it should be no problem. Yeah. Because in the end, it doesn't matter. You just take your participant code in the form of your digital vaccine record, and then your a public key will be sent to all the members. So that shouldn't be an issue.
A question on scope. So will this standard only cover these vaccinations that are determined by law and part of travel restrictions, or is it the format for all vaccinations?
In the future, for all the WHO officially listed vaccines. Yeah, all the WHO registered vaccines. But there will be also local initiatives. So this is for the global exchange. There will be also local extra vaccine initiatives will be included. Yeah, yeah.
So I think to your first question a little bit, is openEHR relevant? Absolutely,
yeah.
Because it will, I think, need to integrate more and more with the existing record systems in hospitals wherever you get these vaccines,
yeah.
right? So this exchange of data will need to happen,
yeah.
At an even
yeah.
larger scale. So yes, then please use the interoperable standards for that.
Yeah, absolutely. One slide further. The WHO has currently these standards for digital public infrastructure for health. And to my surprise, openEHR was not mentioned. So I'm working on it also on the WHO level to, of course, include openEHR in their list of standards they're using. Last slide. Yeah. So this is a lot of books which from around the globe. This will be the end of all these yellow vaccine booklets. Thank you very much. This was it. If any questions more, please let me know.